another exciting edition of your favorite program, Altafe on AIT. I'm your regular anchor, Ushuomowa Daniels, and you're welcome. On the program, we'll focus on everything that concerns your health, the challenges of women and children, with a view to finding lasting solutions. On today's episode, we shall be discussing about the E.T.C strike by Nigerian doctors and its effect. As usual, of course, let's take you through our news segment first.
Côte d'Ivoire has declared its first Ebola outbreak in more than 25 years. The Ministry of Health of Côte d'Ivoire confirmed the country's first case of Ebola since 1994. This came after the Institut Pasteur in Côte d'Ivoire confirmed the Ebola virus disease in samples collected from a patient who was hospitalized in the commercial capital of Abidjan after arriving from Guinea. Initial investigations found that the patient had traveled to Côte d'Ivoire by road and arrived in Abidjan on 12 August. The patient was admitted to a hospital after experiencing a fever and is currently receiving treatment. Guinea experienced a 4-month-long Ebola outbreak, which was declared over on the 19th June 2021. There is no indication that the current case in Côte d'Ivoire is linked to the earlier outbreak in Guinea. Further investigation and genomic sequencing will identify the strain and determine if there is a connection between the two outbreaks. It is of immense concern that this outbreak has been declared in Abidjan, a metropolis of more than 4 million people, says the World Health Organization WHO Regional Director. The country is one of the 6 that WHO has supported recently to beef up their Ebola readiness, and this quick diagnosis shows preparedness is paying off.
As part of efforts to mitigate the effects of the third wave of COVID-19 infection in Lagos, the Lagos State Government, through the Incident Command Structure, has fully activated 10 COVID oxygen treatment and sample collection centers, as well as 20 local government area-based COVID sample collection sites. The centers, which were established during the heat of the first and second wave of the pandemic, according to the Commissioner for Health, Professor Akin Abayomi, have been rejigged and reinvigorated to provide swift oxygen therapy to residents who require it and easy access to COVID-19 testing for citizens. The Commissioner urged citizens who will be visiting the centers to observe and adhere strictly to all non-pharmaceutical interventions of face mask use, social distancing, and hand hygiene as part of protocols to prevent spread of the infection at the sites. Lagos State Task Force on Fake Drugs and Unwholesome Processed Foods have shut 20 pharmacies and patent medicine stores at Shomolu, Bariga, and Oroshoki area of the state. The task force explained that the affected pharmacies and patent medicine stores were shut for contravening regulations guiding the operations of pharmacies and patent medicine stores, including indulging in illegal practices, failing to comply with regulatory standards, and display of expired drugs for sale. The task force noted that only licensed patent medicine vendors are authorized to sell drug products in their regional and approved packs as produced by the manufacturing companies. The closure is part of the government's renewed efforts to sanitize the drug distribution system and curb proliferation of fake drugs in the state. The enforcement and compliance was carried out in collaboration with the National Agency for Food, Drug Administration and Control, NAFDAC, and the Pharmacists Council of Nigeria, PCN. Marburg virus is a highly infectious disease from the Ebola family. The confirmation of an outbreak of the disease in Guinea by the World Health Organization is generating reactions.
If you recall what happened with Ebola, it's a very sad commentary, and I just believe that the immigration officials and the port health authorities should be vigilant to ensure that what happened during the Ebola does not happen again. It will further complicate what we're having in this country.
We must be up and doing right now, because the fight against disease is a fight for all. So it's not just the government or the pharmacists, doctors, nurses alone. No, You must be conscious of your health so that you can be alive to be responsible for whatever situation you find yourself.
Beyond the preventive measures of improved hygiene to keep diseases at bay, the use of medicines for cure has been a potent weapon for humanity. But a situation where about 2 out of every 10 medicines in circulation for cure are fake is worrisome to experts here.
It's been estimated that about over $30 billion is a cost of poor quality medicines in low and middle income countries. Another statistic you want to know is 1 out of every 10 medicines in circulation in low and middle income countries is falsified or substandard. So it's very important that we join hands together with stakeholders in that space to see how we can improve access to quality assured medicines.
Definitely the patient will be at the receiving end. And that is what we are really trying to guide against. Because at the end of the day, when the patient gets the prescription, it's the quality of the drug that will determine the quality of healthcare service delivery that has been put in place for the patient. So the quality of the medicine from the point of production to the point of consumption must be within the regulatory framework, the regulated environment, so that the patient will get the best out of it. Because that is it's a social responsibility of government to ensure that the drugs that the patient is taking is of the right quality.
Some of the effects, it can damage the liver, it can damage the kidney, it can affect the very essence of the harmony that is within every human being. For you to be well and to be of a good well-being, it means that all your system works perfectly. You can take a drug and it disturbs that whole system. It can be a source of any manner of sickness that can arise from the effect of that drug that has gone bad. So our advice generally is that for the practitioners in their various facilities, they should make sure that they maintain the storage condition that the manufacturer has stated in the packaging leaflet and those leaflets. And then for the stakeholder to, when the medicine gets to their homes, they should know that at the point where they are collecting the medicines, they are telling them take 2-3 times a day. And once you finish taking it, don't say because I had this kind of symptoms and I was given this thing. So next time, when I have something like that, I will go back to that medicine that I've kept since 1 year, 2 years, and go and take it. It's not like that.
In the process of keeping it before the last consumers will come, there's a tendency, if the storage is not properly, if medicines are not properly stored, there's a tendency that they will get, destroyed. In the process of that, they will not be able to deliver the purpose for which they are supposed to be taken. And at the other side of it, they are likely to be very, very poisonous to the system.
In the last few weeks, there has been an increase in COVID-19 cases globally, the outbreak of cholera in many states across Nigeria, and now Marburg virus not far away. If nothing urgent is done to improve on medicine's quality, experts fear a situation whereby many will die more from the effects of fake medicines than emerging infectious diseases.
Driven by a vision to be the quality reference in pharmaceutical industries, Biomedical Limited was established in 1981. Biomedical Limited is the first pharmaceutical company in Nigeria to manufacture and distribute intravenous fluids, dialysis and irrigation fluids, and oral hydration salts at a factory located in Ilorin, Kwara State, Nigeria. 40 years down the line, the company has expanded its scope to meet more needs of Nigerians in curative medicine.
At the time when most medicines were being imported into the country, and even those that were being produced in Nigeria were being dominated by foreign multinationals, a courageous Nigerian ventured into manufacture of intravenous fluids. This anniversary also offers us an opportunity to salute the courage of the original visionary of this company, Dr. Farouk Abdulaziz, without whose dogged determination we would not be talking of 40 years anniversary today. In all its years of existence, Biomedical had focused upon infusions production. But in this, its 40th year, the company is breaking out into other products. First, the syrups factory, recently completed, has started putting syrups in the market. We consider this a milestone. However, we believe the public deserves a little bit of background into how that came about. The Bank of Industry made these infusions, the syrups factory, possible, and in spite of our general misgivings about the workings of Nigerian institutions, the BOI proved to be different, at least as far as the syrup factory of Biomedical is concerned. They walked into our factory, said they were looking to assisting companies, the industrial sector in Ilorin. It was almost unbelievable. We produced all the necessary documents they wanted, and they handled it quite professionally. And today we are about to formally present 22 new syrups to the market, with more to come.
As part of activities to mark the 40 years anniversary of the company, the chairman of Biomedical Limited, Honorable Idowu Obasa, disclosed to journalists plans to deworm school children across the country and the launch of an ultra-modern syrup factory.
Another aspect of the anniversary celebrations is the recognition of those deserving business partners whose continuous support makes the story of Biomedical worth telling. Perhaps the most important aspect of this anniversary is the massive deworming of school pupils across the country. To mark this 40th anniversary, we plan to deworm 400,000 children as a corporate social responsibility effort. On Friday, August 27th, 2021 at Ilorin, which will be the exact 40th anniversary, we shall formally launch our ultra-modern syrup factory and present our syrups to the market. Similarly, we shall launch the deworming exercise, which will take us around the country. We invite everyone to join us.
Biomedical Limited are seasoned professionals with youthful and skillful workforce.
We are appealing to the government, to our politicians. They should be thinking of vulnerable people. They can go to the hospital and pay any amount. But what of the people who hasn't got the money to spend? We are talking of insecurity. We are talking of food not on the table of so many people. We are talking of so many things. I have even facility to take care. And some of these our women and children were talking, they don't even have the fund, they don't have the money to go to private hospital. Because the amount they are charging there, some of our women, they cannot even, a person cannot even eat 2 times in a day, and the person is sick, and you want them to pay exorbitant amount that the private hospital are charging. You know, it will lead to massive death in the country. And we can no longer keep quiet as women, who are even on the receiving end, being the most vulnerable in crisis situation. Insecurity has become a part of the normal life in the country, ranging from rape, kidnappings, Fulani herdsmen killings, to mention but a few. Many of our husbands, children, and siblings have been affected and devastated, leaving us economically deranged. There are stories of killings, kidnapping, and stories of dozens of school children adopted from their schools. This excludes the story of armed robbers, ritual killings, kidnapping, and the likes. We seem to have taken the back seat because they are seen as not threatening as domestic violence, incest rape, Boko Haram, armed bandits, farmers and herdsmen clashes. Armed robbery is almost a thing of the past because we are now in a cashless world. Our people are affected to a large extent as their mental well-being is no longer in good shape and they are mentally traumatized. The anxiety of vulnerability or fear of possible unexpected attack eats up the mind of the people of Nigeria. Although some people show the lunatic action as oppressed people fighting for justice. As injustice made them to become kidnappers, as injustice make them to become rapists, as injustice make them to become ritualists, and as injustice made them to become armed robbers. Total nonsense. YWC of Nigeria, women are crying. Our children academics have been severely disrupted. Our hearts are broken and our hearts bled. The big question is, shall we continue to fold our arms and watch our dear country ruined by this monster called insecurity? We say no. Enough of these uniformed security officers. Let the federal, the states, and the local governments seek the help of the local security. And their plans and movements became secret than media matters. Nepotism, tribalism, sentiment should stop in Nigeria. It was one Nigeria before, so shall it be forever in Jesus' name. YWC of Nigeria now call on federal governments of Nigeria to look seriously into this unpleasant situation and take drastic measures to bring this insecurity to a halt, as thousands of lives have been lost. All the citizenry has role to play to achieve some goals of defeating insecurity in our nation, because the perpetrators live with us. Psalm 18 verse 2 says, the Lord is our pillar, our fortress, our deliverer, our rock, our refuge, and shield, so shall it be in the name of Jesus. Amen. Long live YWC of Nigeria. Long live the Federal Republic of Nigeria.
President, I hand over to you authority of life globally for humanity and service to humanity better than any earthly president can do. Your Excellency.
Can we appreciate our new president? Brand new president, Rotary Club of Festac Town, Rotary and Barrister Anselm Alokha. Congratulations, sir.
A transfer of authority there from the outgoing president, Sylvester Bassey Edit, to the changemaker and 40th president of the Rotary Club of Festac, Barrister Anselm Alokha, having supported the Rotary Foundation over the years, which earned him the prestigious pin as Paul Harris Fellow. His investiture to lead the Rotary Club of Festac, District 9110, did not come as a surprise to many.
Before you, I have been decorated with the collarette, which is the President's insignia of office. And before you, I have also humbly accepted to serve as the President of the Rotary Club of Festac Town for this Rotary year. I thank the board and members of the club for the confidence reposed in me to lead at this time. I understand the enormity of the task ahead, and on my honor, I promise to deliver on our shared goals with your active support.
He's a good man. He's been able to motivate his friends and people around him. And that's why you have a household of all the citizens who can support him for his year. He's going to see his project for 20 million. And indeed, he's up to it.
The president is a corporate man, a former executive with the Nigerian Breweries, a corporate organization. So he has brought to the club his wealth of managerial experience, managerial and marketing experience to the club. Of course, we have no cause for alarm. We just go home and sleep. And of course, expectedly, we are to assist, not when necessary, before it is necessary.
Due to the prevailing challenges of our times, healthcare provision and the gospel against the spread of COVID-19 virus is taking a major attention in the 7 areas of focus for the year.
We intend to provide health facilities, donate health equipment to hospitals around us. COVID-19 has come to stay, and I think a lot of awareness has been created for us to take both the pharmaceutical and non-pharmaceutical measures to safeguard our health. So I expect that we continue to abide and ensure that we do all that is required of us by way of carrying out all the non-pharmaceutical things. We expect that once vaccines are available, people should go out there and take the vaccines. There's nothing negative about the vaccines. I have taken and I'm still standing here, hale and hearty.
Doing management that you build on the previous administration. This year we're focusing on the women and the youth. The intention of this present administration is to ensure that we assist with the maternal care and the youth. Children, especially those under 5 years of age.
Other areas of focus include preserving the human environment for survival, security, education, water and sanitation.
Renovation of the police station, the human rights block of the police station, and to support the team in ensuring that they secure our environment better.
The event also featured induction of the board of directors and new members into the club, including the wife of the president, Dr. Mazi Alokha. Individuals who have contributed to the growth of the club were honored.
One of your outstanding contribution to humanitarian service and guidance to the club. The club appreciates you and will continue to count on your wisdom. Thank you so much, sir.
Can we put our hands together for that, please?
This award to you as a sign of our appreciation of all you are doing for humanity.
A consummate salesman and administrator who spent most of his work years at the Nigerian Breweries PLC, Barrister Anselm sits on the board of Vision Asset Consulting, a firm with operations in Nigeria.
Blessed with 4 children, the Edo State-born Rotarian from Agenebode is also a member of the Nigerian Institute of Chartered Arbitrators, a fellow of the National Institute of Marketing of Nigeria, and a fellow of the Institute of Corporate Administration. Under his watch, the Rotary Club of Festac, which was admitted to membership of Rotary International on December 2, 1982, under the then District Governor, Rotarian Julius Adeluyi, will no doubt grow tremendously in all ramifications.
Thy praise is high, I love to sing. Rotary, my homage now to thee I bring, now to thee I bring. Rotary, my road, with friendship, loyalty, and cheer, I'll serve my brothers far and near, and hold thy precepts ever there. Rotary, my Rotary.
President of the Pharmaceutical Society of Nigeria, Sam Mazi has expressed displeasure over the strike by resident doctors that has lingered for 3 weeks.
Symptomatic. It is symptomatic of the problem of our country, of poor leadership. Symptomatic. How many times has NMA gone on strike? How many times have resident doctors gone on strike? Are we ever ashamed? You make promises to the people who work for you and you don't keep those promises. Part of that's the problem is infidelity. Some professional groups like the Pharmaceutical Society of Nigeria, maybe nurses, are more pliant. They are more willing to accommodate this infidelity by government against its workers. But the resident doctors don't have that patience, and they have repeatedly shown it, and yet it's going on. At the end, they won't work. At the end, they will get paid. The patients will have suffered, everybody. Why couldn't we have prevented it? We are saying they didn't give us notice, they didn't give us notice. If we stopped it, we'll save the nation the problem. But go and write it down. This country will still pay these doctors at the end, and we've lost manpower, we lost patients. Why?
With the rising cases of COVID virus across the globe, he called on Nigerians to take caution.
We must take all the precautionary measures that are required to both pharmaceutical and non-pharmaceutical prescription. But what is important, let us escalate vaccination. The moment we escalate vaccination, we'll be able to give a higher cover and maybe acquire the herd immunity, because we're going to live with COVID for a long time. So we better got the immunity to protect us so that we can live a near normal life.
Mazi Owambuwa, who was speaking at the National Stakeholders Meeting of the New Nigerian Group in Lagos, said he was passionate about building a country where healthcare is given a priority, a country that works for all.
Nigeria needs to install a leadership that is enlightened, a leadership that is visionary, self-sacrificing, committed, a leadership that is competent, of good character, and has courage to redirect the nation. Our nation is underperforming, and 2 things are responsible: poor economic performance and lack of national cohesion. And what we're saying is that the New Nigeria Group is committed to push Nigeria to move from a third world to a first world, and thereby become a developed nation. And that will deal with the economic problem. All the processes to improve our capacity, productive capacity, our ability to produce, to create job opportunities, and to make sure that standard of living goes up. That will be part of the effort to leverage productivity. Our problem is low productivity. The second is to build a nation of citizens that love their nation. And that's because their nation cares for them. The nation is concerned about their education, about their health care, about their safety, about their well-being, about their dignity. The moment you get a nation that recognizes the dignity of people, is concerned about their health care, their welfare, and their safety, then that nation will love the country back and the citizens will become patriotic.
The event, which concluded the launch of the new Nigerian Group chapters in all 36 states of the Federation and the activation of his 2 strategy, coincided with his date of birth.
Happy birthday to you. Happy birthday to you. Happy birthday, Mazi sir. Happy birthday to you. Hooray! Let the good Lord bless
Born on 16th of August 1950, Mazi Sam Ohuaboa is a pharmacist, politician, and business executive from Arochukwu in Abia State, Nigeria. He is the founder of Nimes Pharmaceutical and the current president of the Pharmaceutical Society of Nigeria, PSN. Mazi Sam Ohuaboa, who has served Nigeria in various capacities, is a fellow of several professional organizations. He is humble and God-fearing. For many present at the new Nigerian Group Stakeholders Meeting on Monday, the 16th of August 2021, Mazi Sam Ohuaboa is giving the support to rule Nigeria come 2023 as all it takes to make Nigeria a country that works for all, free from corruption, injustice, insecurity, and poverty.
Thank God for bringing and making Mazi to accept being a president of this country come 2023. By the grace of God, the new Nigeria must stand. Amen. Mazi Ohuaboa will change the economic of this country. We are not going to play the money box politics. It's not going to be the money box politics anymore. All of you here, the people who have been shouting, they want to be the president, they want to be the president, they want to be the president. If you look around, you can see that none of them is the classmate of Mazi Ohuaboa. So here, I am calling the attention of all Nigerians. Be a Muslim, be a Christian, be you who has no religion, I tell you, Mazi Ohuaboa is the audacity of hope comes 2023, inshallah.
Strike is the common way through which workers in Nigeria express displeasure over poor working conditions and unfavorable policies. Even though strike does not seem to be yielding the desired results, workers keep exploring it as an avenue to get government's attention. Resident doctors in the last few weeks have stood their ground of no retreat, no surrender until government answers to their demand, a situation that has left many patients to their fate across the country. I took up a young doctor, Windakpo Oluwakemi, up on the situation. Windakpo Oluwakemi is a young doctor in training, and she's the current president of Association of Resident Doctors at the Federal Medical Center, Ebute Metta, Lagos. She's not happy that patients are suffering. The burning desire to help patients that led her to study medicine seems to be dying gradually, with what she describes as insensitivity on the part of government.
My decision to study medicine was born largely out of, let's say, adoration for my father. My father is also a medical practitioner and has been for over 30 years. So growing up, going to his hospital and seeing the way he interacts with his patients and the level of trust they have in him and the level of appreciation they have for him. One experience that is particularly dear was at a point when we traveled together and at the airport we met a man that came to, how will I say, dobale in front of him that, sir, thank you, sir. So essentially what had happened was that the man was my father's patient in the past and he had practically saved his life. So seeing those kind of things, they piqued my interest, and seeing it as a noble profession that's filled with prestige and service to humanity. At that point in time, all that was at the back of my mind was, okay, this is a profession where they help people and it looks good. So I went into it with zeal, with passion to help people at the end of the day.
So going to school, how was it like? How interesting, how challenging was it?
So my father was a doctor, so you can imagine that I had his guidance, like he would give me advice on what to do. But generally speaking, and as someone that went to College of Medicine, it was an arduous experience. It was emotionally challenging. Do you understand me? Because the exams are difficult, sometimes unnecessarily difficult. The hours you need to put in to achieve like bare minimum success was a lot. For me, finances was not a problem because I didn't have to work to put myself through school. I had my parents, and all I had to do was just study, and study was all I did. and it was always emotionally, at least for me, challenging. And let's not even talk about the fact that when we talk about facilities in the medical school, like the hostels were terrible. The hospital itself, I went to school in Luz. Sometimes you don't have water to wash your hands. You had to provide all those kind of things by yourself. You carry your hand sanitizer in your pocket. So those are the kind of experiences we had in medical school. And as students in College of Medicine and in University of Lagos, I feel like we're more fortunate than most people in other places, because at the end of the day, we didn't spend more than 6 years in most cases. Meanwhile, I have colleagues that we entered medical school at the same time, but their training was marred by things like strikes, ASU strike and things like that. And at the end of the day, they finish after 9 years, 10 years and things like that. So it's a very tough and very difficult process. The kind of zeal I went into medical school, it kept on reducing as the years went by. So at the end of the day, it was now becoming like, in fact, let me even finish, at least let me even graduate from school and find my way. Do you get? Then I started my internship and I found the zeal again, because it was very fulfilling for me. Like being able to help patients from when they come in sick to discharging them like healthy and whole again. It was fulfilling. And at that point, I wasn't exactly fending for myself. So like finances were not really at the back of my mind. But at the time too, work was difficult because the patient load was a lot, the staff strength was down and things like that. So my present state of mind is a job. But still, because my practice is obstetrics and gynecology, and it's a happy practice, because especially the obstetric side of it, we deliver babies and it's always a joyful experience. So most of the times when I'm at work, I find joy in my work. Even now, I still have passion for my work. But there are times that I feel overwhelmed and I feel sad, because the work I'm doing, maybe 4 people should be doing it. Do you get? So when you're in that kind of situation, you can't but just feel like, what is it that I'm doing exactly? Do you understand? So the passion is still there, but sometimes it gets overshadowed by the stress and the conditions that you are subjected to. The facility I work in, to be honest, is better than most. It's not the optimum, but at least we have a medical director that does his best, but can be better. So our issues here, like our local issues in this hospital, is mostly relating to manpower, like I said. If you do the statistics, there's over the last few years, because we've had like improvements in the infrastructure of this hospital, and there's been a lot of public relations, our patient load has gone up about 75%. So in that same period where our patient load has gone up, the number of doctors has declined. You know, like we say, there was the brain drain. In fact, now it's storming, a brainstorm. So the decline is by 22%. So you imagine that if patients are increasing by 75%, doctors should also increase. And we're saying that the recommended doctor-patient ratio should be 1 to 600. This one that we're calculating is over 1 to 10,000. Do you understand me? So the workload is a lot. Let me not just talk about myself. Our house officers, right now the house officers are being centrally placed by the Medical and Dental Council. So at this time last year, we had about 40 house officers that were posted to this hospital. And right now we have 11. So we have 11 doctors doing the work of 40 people. So you can imagine, you'll be stressed, you'll be burnt out, you are overworked, you're underappreciated. Like upon everything, you still have people shouting at you, you have patients insulting you. So it just takes away from the joy, it takes away from the passion, and it's failing and it's continuing to take a nosedive. So my expectations have totally been crushed.
So if you have a way, what would you do? You have an option.
I have options. I've just chosen not to explore them, because apart from being passionate about medicine, I'm also a patriotic Nigerian. So when we have these discussions, as medical students, we used to discuss that, okay, after medical school, what pathway are you taking? Are you writing PLAB? Are you writing USMLE? I was always in the position of Niger for life. I'm never leaving. But I have options. And if it has to get to that, I don't mind exploring these options.
So since the strike, what has been happening here? What's happening to emergencies? How are they operating? Because I had the nurse begging you now that before you go, you help them.
To see one patient, unfortunately, I can't help her see any patients. But the way the hospital is run, we have different cadres. We have the junior residents, the senior residents, and consultants. So junior residents, senior residents are not around. So only consultants are attending, or people at the level of consultants are attending to the patients.
What happens to emergencies?
Patients are not being admitted to the wards because who is going to care for them on the ward? It's the resident doctors that do the daily rounds, attend to their every need on the ward. So as there's no resident doctor, there's no need to admit. So just outpatient clinics are being run by the consultants. And then the emergencies, when they come, we have some senior medical officers, some principal medical officers and chief medical officers that are running the accident and emergency. So all they do is they stabilize the patients and refer them for onward care.
Now, since the strike started, what have you been doing with your time?
So as the president, I have to ensure that my people are complying with the strike. But that has not even been difficult for me because they are not even interested in coming. Like, you know, when we have things like this, we have people that we call defaulters because they want to maybe pander to the management or pander to their consultants, or they were threatened by their consultants. So we have to come and sort out those kind of issues. But most of the time, when I come to just go around, ensure that my members are not working, I just spend my time in the library reading because, you know, as a resident doctor, I'm always reading. I'm getting ready for my exams. So that's what I've been up to.
This issue of government and the strike, how long do you think it will continue? What can we do to find a lasting solution?
The lasting solution that I can see is if government should come to the table, the negotiating table, and answer all our demands. Government should accede to all these demands so that we don't keep on going back and forth. It doesn't make any sense and it doesn't make anybody happy because I don't like just leaving my work. Because, for instance, now I have patients that are booked for antenatal care. They cannot continue the antenatal care here because it's going to attend to them in the labor ward. They've donated blood, they've done antenatal tests. And when they go elsewhere, they'll have to donate blood again. They have to do the antenatal test all over again. It's cost. And these things are expensive. So I feel for them. But unfortunately, it's out of my hands. We know that we're essential services. But before you offer essential service, your own self is more essential than the essential service that you're going to render. Because even our Hippocratic oath that people keep on quoting that will attend to everybody and everything, before all else, it says that I will attend to my own health, well-being and abilities in order to provide care of the highest standard. Do you understand? If I am not well, I cannot take care of you. Imagine I come to work, I haven't been paid, I am hungry, I fought with my husband, I am angry. I am now saying I should attend to this multitude of people. They cannot get the best care and they should be very afraid. Imagine if our leaders had to use these our public facilities, if they were mandated to use FMC Butimeta, use LUS, use National Hospital, our hospitals will be better because they have the option of medical tourism. If they didn't have this option of medical tourism, I strongly believe that our health institutions will be stronger and better.
Thank you very much. It was having you on the show.
Thank you very much, ma. Thank you for coming. I really appreciate it.
My name is Dr. Shodipo Oluwajimi. I am a consultant family physician. I've been to the isolation center and I've seen people struggling to breathe while they use oxygen. We have a responsibility to prevent this deadly illness. Use your face mask. Practice social distancing.
Wash your hand all the time. Prevention is better.
Together, we can fight coronavirus.
If you're just joining us, it's Health Affair on AIT. Next on the program is our nutrition segment.
Tiger nuts, also known as earth almonds, were one of the first plants cultivated in Egypt and traditionally used as both food and medicine. Tiger nuts are rich in a variety of nutrients and have been linked to several health benefits. Tiger nuts are rich in antioxidants, which are beneficial compounds that protect your body against aging and diseases like cancer and heart disease. Tiger nuts also promote digestion in various ways. Contents of tiger nuts are as follows. Calories 103 to 121 grams. Fiber 2 to 7 grams. Carbs 9 grams. Protein 1 gram. Fats 7 to 9 grams. Vitamin E 278% of daily value. Iron 13 to 40% of daily value. Phosphorus 9 to 11% of daily value. Vitamin C 2 to 8% of daily value. Magnesium 3 to 5% of daily value. Zinc 5 to 7% of daily value. Potassium 3 to 5% of daily value. And calcium 1% of daily value.
Our clinical segment is insightful. We bring health consultation and diagnosis closer to you.
People ask what are the symptoms of cervical cancer. I can reel them off on my fingers. One is a discharge. A discharge that is not going away. Bleeding. Women are supposed to bleed periodically. That's why we call it period. But if it's no longer periodic, bleeding every day, everywhere, anywhere, it is not acceptable. Bleeding after intercourse. Women are not supposed to bleed after intercourse. We call it postcoital bleeding. It's a sign of cervical cancer that there's a problem. Women bleeding after menopause. When women finish their period, they reach a stage called menopause, the end of periods. But women start bleeding again after they've already said bye-bye to period. That's called postmenopausal bleeding. When the cancer has now advanced away from the cervix area, it can now start affecting the pipes, draining urine from the kidneys and cause total blockage of urine passage. That is the final stage, and that is not acceptable. Because by the time women are noticing these symptoms, it is too late. That's why the focus is on prevention. Before the symptoms start appearing, women should turn up and do screening.
Your opinion is relevant to improve the nation's health sector and human lives. This is why we give you a voice on our perception segment.
Can you put me, I will leave my family, come to stay at the isolation center working as a doctor? Do you know the day I close there, if I work there for a month, the day I close there, I cannot go directly to my house? Do you know that? I'll still have to go on isolation. Do you know the sacrifice, knowing that I myself am exposed to? And yet you can still withhold allowances and money from such people? No, what are we talking about here?
This is where we draw the curtain on the program today. Thanks for staying with us. Please endeavor to join us same time next week for another exciting edition of the program. You can be a part of the program by dialing the numbers showing on your screen or reaching out to us through our social media platform. My name is Oshuomowa Danes. Please keep staying safe.